Hello, I'm nurse practitioner Soshil, and I'm going to do your physical examination today. What's your name?
Carolyn Alvarez,
What day is the date?
March 28th.
Okay, I can see that the patient is alert and oriented. Her general appearance is appropriate for her age. She's well nourished. She doesn't have any skin discolorations, any lesions, any rashes, any moles. The patient, I observe that the patient does not have any involuntary movements. Her face and her body is symmetrical, normal facial expression, normal speech, normal mood and affect. She's in good hygiene. Okay, so I have probably washed my hands already, and I'm going to use a little bit of hand sanitizer as well. Okay, Ms. Alvarez, I'm going to check your vitals. Is that okay with you?
Mm-hmm.
Okay. So first, I'm gonna start with your pulse rate and your respiratory rate. Just relax and breathe. All right. So your pulse is 70, your respiratory rate is 20, is perfectly fine. So I'm going to check your blood pressure. Let me check your brachial artery first. Excellent. Your blood pressure is in the normal range, 120/70. Okay, so now I'm going to inspect your head. I can see that she's normocephalic. She doesn't have any lumps, any lesions. Her face is symmetrical, which is that she has a good cranial nerve number 7. I'm going to palpate your temporal artery. Let me auscultate it really quick. Okay, she doesn't have any bruits. So I'm going to palpate your temporomandibular joint. Can you open your mouth? Close. Again. Okay. So she doesn't have any clicks, any decreased range of motion. I'm going to check your sinuses, and you're going to tell me if you feel any pain when I press. Any pain?
No.
Okay. Okay, so I'm going to inspect your ears. I can see that they don't present any abnormality, any lesion, any discharge. They are in good alignment. I'm going to use the otoscope, so I can see the other side. She's an adult, so we're going to move up and downwards. Okay, I can see that the patient tympanic membrane is pearly gray, which is normal. No signs of inflammation or infection. I'm going to assess your hearing. I need you to cover one ear with your finger, and I'm going to whisper something, and you're gonna tell me what I'm telling you.
ABC.
Now with the cover the other. 1, 2, 3.
1, 2, 3.
Okay, perfect. So now I'm going to do the Verbena test. You're gonna tell me when you hear the sound. Okay. Okay, now I'm going to check your vision. Do you wear glasses or contact lenses? No. Okay, so I'm going to check your vision. I need you that you cover one eye for me, and you tell me what are the smallest letters that you see there.
LTFPH, CFDHJ, EPTZO.
Excellent. Now cover the other eye and read the same letters. You can read only on the bottom ones.
LTFPH,
Good.
C.
Good. That's good. You assessed for visual confrontation, which I'm assessing cranial nerve number 2. I'm going to, I need you to look into my eyes with both eyes. Okay. So I'm going to see. No, look at me. Okay. She has orbits and iris in good position, size and shape. So look up. Let me see your. Okay, patient shows white sclera, pink and moist conjunctiva. She's in normal limits. So I'm going to assess pupillary cranial nerve 3, 4, and 6. So I need you to look into the distance. Look into the distance. Into the distance. Now I need to assess accommodation. You have to follow the pen. Perfect. She has good accommodation. So I'm going to darken the room. For the purpose of the video, I'm going to use this tool as a ophthalmoscope, and I'm going to observe your eyes. So I can observe the orange glow in pupil as well as red reflex from retina, which is in the normal limits. So now I'm gonna check your nose. Okay. can see the anterior and inferior surfaces of the nose, which is are in the normal limits. So I'm going to assess your mouth now. Okay, I can see that the patient lips are symmetric. I need you to open your mouth. Okay, I don't see any abnormalities in hard and soft palate, buccal mucosa, gingiva, and tongue. Teeth and gums are in good conditions as well. So I need you to say ah. Okay, no abnormalities in tonsils or on the pharynx. So with that, I'm assessing cranial nerve 9 and 10. I'm going to check your gut reflex. So I need to open your mouth again. Okay, I'm going to need you to stick your tongue out for me. Okay, that your cranial nerve number 12 is good. So I'm going to check your neck now. Neck is symmetric. I don't see on inspection any lumps, any vesical pulsations. I'm going to assess your lymph nodes. I'm going to start with the auricular lymph node. Postauricular. Occipital. Submental. Cervical. And the supraclavicular lymph nodes. Okay, excellent. Relax your necks, place your necks slightly forward. Okay, I'm going to assess your trachea. Okay, the trachea is in midline, no deviations. I'm going to inspect your carotid arteries. Okay. I'm going to palpate both carotid pulses. Let me auscultate for bruits. I'm going to check now your thyroid. Fold your head back. I'm going to palpate your thyroid gland. Any mass is noted. Okay, flex your neck forward. Forward. Palpate the isthmus. Okay. I need you to swallow water. Okay. Perfect. And now I'm gonna check your range of motion. I need you to move your neck up and down and to the sides. Okay. I need you to train your shoulders. Okay. Now I need you to train your shoulders against my resistance. Okay, good. Now I need you to move to the side against my resistance. Okay, now this way. Good. I just checked cranial nerve number 11, and it's normally fine. Now I'm checking your you have normal respirations, regular rhythm, normal effort, no cyanosis, no clubbing, it looks symmetrical, no scars, no lesions, no lumps. So I'm going to palpate your lower thoracic expansion, breathe in and out. So I'm going to assess for parameters. I need you to say 99,
99, 99, 99, 99.
perfect. So I'm going to percuss I'm going to measure this way. I'm measuring and assessing for diaphragmatic excursion. Now I'm going to auscultate your lungs. Breathe in and out for me, please. Good. Okay, now I'm going to assess your chest. I can see that breath are symmetrical, no scars, no lesions. Try your hands for me, please. Okay. Now place both hands in waist. Press your elbows forward. Okay. On palpation, you can see there is no lumps. Okay, I'm going to assess your parameters. I'm going to say 99 for me, please.
99, 99,
Okay. I'm going to percuss your anterior lung fields. Okay, perfect. Okay, now I'm going to palpate the apical pulse. I'm going to auscultate. Good. Now I need you to roll to the left side. Okay. Now I'm going to palpate your apex. Good. She doesn't have any mitral abnormalities. Okay, on inspection of the abdomen I can see that the abdomen is symmetric, no obvious lumps, no distension. I can see a flat contour, visible aortic pulsations. Now I'm going to auscultate their bowel sounds. on auscultation, I can see that the vowel sounds are normal active in all 4 quadrants. I'm going now to auscultate the aura. Good, and the renal arteries. Iliac. And femoral. Good. Now I'm going to percuss your liver and spleen. No palpable liver and spleen. I'm going to use a loud palpation to assess for mass. Any pain? I'm going to go a little bit more deeper now. Good. Now I'm going to check. You're gonna tell me if you feel pain in the right side when I release my fingers from here. Any pain? Good. Now I'm going to palpate your kidneys. And the bladder is not distended. Perfect. Now I'm going to assess your shoulders. You're gonna raise your hands in your head, lateral. Okay. Now you're gonna put your hands behind your neck, and you're going to try to touch your spine. Any pain? Okay, perfect. Perform the MPCAN test. I need you to put your hands like this. Put your tongue down. Any pain? Okay. Now, I'm going to perform another test. Now, you're gonna raise your hands and put the thumbs. Okay. Now I'm going to lift your hands. Any pain? Now with the other hand. Any pain?
No.
Okay. So the near test is fine as well. I can see there is not any deviation, any scars, any lesions. Please flex and extend your neck. Good. Now rotate head left and right. Okay. Bend your spine side to side. To this side, and the other side. Good. I can see there is no scoliosis, no abnormal curvature, no lordosis, no kyphosis. So let me palpate your cervical spine. Perfect, excellent. Okay, on inspection of the knees, I can see that there is no deformities, no effusion. Both knees are symmetrical, equal in shape. I'm going to assess if they can flex and extend. Any discomfort?
No.
Okay, now I'm going to extend your knee in 90 degrees, and you're going to tell me if you feel any discomfort.
Mm-mm.
No discomfort. Okay. Now I'm going to do the Lashman test to check your ACL. Okay. I'm going to hold your tibia, and you're going to tell me if you feel any pain when I move.
No.
Okay, now I'm going to assess your hips. I need you to tell me if you feel any pain when I rotate your legs.
No.
Okay, perfect. To check, I need you to put your knee over your chest. Okay. I can see that she has a positive Thomas test because the other leg is lifted off the table while I perform the test, which is a positive sign. Okay, now I'm going to assess the cranial nerve number 5. You're gonna tell me when you feel. You're gonna say yes if you feel
Yes.
my toes.
Yes. Yes. Yes.
Okay, perfect. So I need you to clench your teeth. Okay, one more time. Okay. Okay, the temporal and massage muscles of my patients are good. So I'm going to assess the cranial nerve number 7. I need you to raise your eyebrows, frown, smile. Good. Close your eye tight. Okay. Show your teeth. Good. Puff both cheeks. Perfect. So cranial nerve in my patient, cranial nerve number 7 is in good condition as well. Move your shoulders. Okay. Now I need you to move your elbows, flex. Okay. Your hands. With your hands, move your hands. Okay. Perfect. Cross your arms. Okay. You don't have any loss of balance or anything. Close your eyes now. Okay, perfect. I'm going to check your reflexes now. Normal biceps reflexes. Normal triceps reflexes. Good. Very good. Now, I need you to close your eyes. Give me your hands. You're gonna tell me what number I'm going to draw in your hand.
8.
Perfect.
3.
Perfect.
0.
Perfect. So I just checked the graphesthesia, which is it was positive. Now I'm going to check the stenosis. I'm going to close your eyes. I'm going to place an object here, and you're gonna tell me what it is.
Okay.
Perfect. Very good. I can see that both legs are symmetrical. I don't see any varicose veins, any lumps. Okay, now I'm going to check your genitalia really quick. I can see that the patient has no abnormalities, no visible lesions, no discharge, any abnormalities is noted. Okay, so we're done with the physical assessment. Do you have any questions or concerns?
No.
Okay, just remember to eat a healthy diet, do regular exercise, and we'll see you next time.
Okay.